Hi, my name is Jessica Lancaster, and I first heard about COVID-19 actually at a meeting for scientists in Tucson, Arizona. I'd heard that there was a virus coming from Wuhan, China, and that it may become an area of intense scientific interest because it was a new type of virus. My initial reaction to the closing of institutions was actually with some skepticism. I thought it seemed like perhaps there was too much concern about what could happen. This was also during March of 2020. I had just started my lab the week before, and I was very excited about setting up my lab and starting my research program. And then these restrictions had come in, and I was very confused, like many people were, as to the magnitude of the situation. I didn't have to leave the research institution. I started my lab, and I still am in Phoenix, Arizona, and we were required to go onto shift work, but at the time the lab was only me, and so I would go in every day and work on my own to try to do what I could to keep starting my research program. Since I started my lab in 2020, for the most part, I was able to continue my research. It had to be modified. For example, I couldn't bring in animals for a while. However, I think that for a new scientist, starting a new lab is always a challenging time. And so perhaps I felt like this was just a part of the challenges of starting a new research program. I didn't have much basis because I was new to my institution. Certainly, we were very impacted by what was going on in the hospital side of my institution. And I understood that there were nurses and physicians that were quite overwhelmed, especially in our region, dealing with the caseload that was quite significant. And for me, the research could continue, but of course I was on my own for a while before I could hire personnel and then bring them onto campus. COVID-19 did affect my career trajectory significantly. I study the aging of the immune system, and this was a topic that I had selected even before I knew about the coronavirus pandemic. And interestingly, I've gone back into my research interests writing that I wrote in my job applications, and I had talked about things such as MERS and SARS as being potentially emerging viruses. Of course, I had no idea of the magnitude of what could happen in the future, but this pandemic had really illustrated that older people were more significantly impacted by the disease, and it really highlighted that the research I was doing is actually important because we understand very little about the immune system of older individuals. I'm quite divided about how I feel regarding my field. In one part, immunology and understanding the immune system is very important, and it's still in many ways a black box when it comes to healthcare. We really don't have ways to understand how a patient's immune system is behaving and whether it could be better or restrained in order to prevent severe health outcomes. At the same time, I feel that there's this tendency among especially scientists and academic science to kind of look down at other people who may not understand the science. And I feel that this has created a lot of kind of stress in the public because people sense when their voices and their perspectives are not being heard. And so I think there has to be kind of a lot of effort that needs to be made in order to kind of bridge the divide, in order to help the general public understand better what we do as scientists and what we're trying to understand in order to promote better public health.